Thank you for joining us in this interview today. I'm Jean Sénémo, a vascular surgeon in Henri Mondor University Hospital in Créteil, France, and a member of the social media team of the PVI Congress held in Paris. I'm happy to present to you the Professor Sabine Steiner, who will be a member of the scientific committee in the PhD session of the Paris Vascular Insight course next December. Professor Steiner, could you please introduce yourself for those who do not already know you?
Thank you very much for the kind introduction. I think you said most of the important points. So most of all, I'm a member of the scientific committee in the PhD section together with very esteemed colleagues for the PVI course. And this is really a privilege. For my background, I'm trained in internal medicine and angiology, focusing on endovascular interventions now for quite a while, working at the University Hospital in Leipzig, Germany.
To say peripheral artery disease is the core of vascular surgery and interventional radiology practice. Despite technical advances, PAD remains an immense challenge to overcome. In such settings, what is the main impact of the new PAD guidelines released by the European Society of Vascular and Endovascular Surgery?
I think it's not just the guidelines you just have mentioned. We actually kind of face the year of the guidelines, I would say. So as just recently, beginning of June, the American guidelines have been published. And we are waiting for the guidelines of the European Society of Cardiology by the end of August. And I think what we see in all of these guidelines is really kind of putting emphasis on the multidisciplinary approach for treating patients with peripheral arterial disease, focusing probably more on patient-centered outcomes, although it's very often very difficult to integrate that into clinical trials. But what I think it's interesting about these guidelines, they all have the same literature, or let's say the data available, but the conclusions are sometimes quite different. For example, when we focus on atherectomy. So I think it's really interesting to look at how these various aspects evolve between these guidelines. And this would actually have been also a nice topic for the PVI course in the program to compare these guidelines, but maybe we can do so in 2025.
And specifically regarding recent publication on infrainguinal diseases, do you think scaffolding is making a comeback?
I don't think it really needs a comeback. It's always have been at the core of treating femoropopliteal disease. I think we just gave up a little bit this idea that we are really able to leave nothing behind, especially in complex disease. We do need some scaffolding, and I think it's good that we move back to focus on which kind of stents are we implanting, what are optimal implantation techniques, and especially what's the restenotic process between various devices, also when we look at various time courses. So I think it's just important that we still focus on scaffolds because they will always be a really important part of our treatment strategies.
And what will you think that will be the next steps for bioresorbable stents?
First of all, I think the field is really getting crowded. So Life-BTK, of course, the clinical trial was kind of able to hit this sweet spot of offering enough mechanical support, but also the suppression of the inflammatory response over time with this bioresorbable scaffold. But there are several other BRS within clinical trials, and others are just moving forward. So I think we will see at least 4 to 5 various devices for PTK disease. And there's also one studied for femoropopliteal disease. So I think it's very important that we will have to consider these differences in these chemical and mechanical properties, coating technologies, differences with respect to radial force and absorption profile over time. So I think there's really a lot of work out there to be needs to be done for these devices to be used in clinical routine.
And finally, what are your expectations for limus-eluting devices for the femoropopliteal and below the knee segments?
So especially focusing now on limus coated balloons, I think the bar is really set high by paclitaxel, especially, of course, for fempop disease. Paclitaxel coated balloons really showed that they can successfully inhibit this first neo-intimal hyperplasia, and it will be difficult to achieve here superiority. I think it would be great if some of the devices actually can show non-inferiority. We will have some data on the Magic Touch balloon available soon, but as for the paclitaxel coated balloons, I think really each device has to show efficacy and safety within a clinical trial compared to paclitaxel coated balloons. For BTK, it's even more difficult because the heterogeneity of lesions is even higher. And I think it will be really very difficult here to show superiority versus standard balloon angioplasty if you're not able to really select the lesions very well. And that's the major challenge here within the clinical trials.
Thank you, Professor Steiner, and thank you all for watching us. We're looking forward to welcome you in the next PVI course next December in this unique platform to stay up to date in various topics, to share your experience, and to meet worldwide experts. See you in Paris.